is Dr. Julie Gunter. I am a veterinary dermatologist and I work at Mississippi State University, College of Veterinary Medicine. I am from Mississippi and I actually went to veterinary school at Mississippi State, and I have been practicing for about 25 years, most of that dermatology. And right out of vet school, I decided to pursue an internship, and I did that at Texas A&M University. It was a general rotating internship, so I went through a lot of the different rotations that are with small animal, and didn't really know what I wanted to specialize in. I just felt that call to specialize, and I figured out through many months of thinking about it, spending time with dermatologists there at Texas A&M, that I wanted to pursue dermatology. So I applied for residencies, ended up at Auburn University, and did a residency there and a master's degree at the same time, and finished that around 2000. So I came back to Mississippi State because I'm from Mississippi, and at the time we had never had a dermatology trained veterinarian. So I wanted to bring that service back to Mississippi State to teach the students about my field that I enjoy. With dermatology, we take care of a lot of pets that have allergic dermatitis, because that's the manifestation that's strongest in dogs for allergies, either food-related allergies, flea allergy, or even environmental allergies. People have more respiratory issues, asthma, hay fever, runny eyes, runny nose, and sometimes dogs and cats will have those symptoms as well, but typically they have itchy skin. So that falls under a dermatologist as opposed to, in human medicine, an allergist. So we kind of do skin problems and allergy type workups for pets. And I would say the other things that we do, we take care of dogs with chronic ear infections and also autoimmune skin disease like pemphigus or cutaneous lupus. And we also treat animals with chronic skin infections, and that can be anything from bacterial to fungal. So we have a big broad range of diseases, but I would say on a day-to-day basis, most of us are dealing primarily with an allergic dog or cat. However, we do have the other things that creep in, and there are a lot of dermatologic issues that are signs of internal disease. So we're trained to recognize these, diagnose, and get the pet on the way to a workup to help them either get well or just find out what we can do to manage the problem. This is Maud. Maud is a 9-year-old female spayed French bulldog. I'm sure y'all seen Frenchies before. Unfortunately, some of them do have some skin allergies. And in a dermatology appointment, what we do is we really like to get a very thorough history. So the owner fills out a form that tells us about their perception of the animal's skin problems, and a history on how things started and how things have progressed and what treatments have been done. Many of my patients are referred, so that means that a veterinarian has been taking care of the pet, but then they need a different level of care, potentially some allergy testing or something that's not done in general practice. So Maud came here from different states. So Maud has lived in Colorado, California, New York. She did have some problems with her skin allergies in those states, but when she moved to Mississippi, things seemed to worsen, which is not uncommon because we have a lot of pollen in Mississippi. We have very mild climate, so we don't get a lot of variations of seasons. So Maud came in today because her face is really itchy, and she's also licking her paws, which are very common signs of allergy. And she also has had trouble with her ears. So in this appointment, we were assessing what we could do for Maud at this point in time. Maud is not expected to stay in Mississippi, so we were primarily trying to find out how we could treat her symptomatically, which means just controlling the skin infections that can occur with allergies, and also the itchiness. So we did an exam on Maud. We looked thoroughly at her skin, in her ears, which should always be a part of your dermatologic exam. And we found that we needed to do some skin cytology on Maud in her facial folds because there was some inflammation present there. So we took some skin cytologies, we took some ear cytologies to look under the microscope and figure out, does she have any infections, or are all of her signs at this time more
These are ear cytology that we took from Maud. The first step is to prepare this slide by heat fixing it. The key is to not get too close to the slide with the flame and wave the flame back and forth a few times. Now I'm going to make sure the slide is not too hot. Next is the dipping process. This process is called a diff quick stain. Always start from light and go to dark. I do 10 dips in and out and go straight to the next one, and then I rinse after the purple. The first light colored container is the fixative solution. The second red tinted container is an eosinophilic stain. The third purple container is a basophilic stain. Now I turn on a light stream of water and run the slide under the water until the stain runs clear. Alright, I'm going to set this slide down to air dry. Now for these next slides, I'm going to take a 3cc syringe and use the purple basophilic stain. I pull the tape up and place a drop in the center. Then I lay the tape back down and attempt to disperse the stain around the slide. On these slides, our focus is bacteria, yeast, and sometimes inflammatory cells can be seen, like neutrophils. Now I wait for the ear cytology slide to air dry, and it will be good to look at under oil immersion at 100x. I will also view the tape preps at 100x. This is the oil we use when attempting to view very small cells. Now I just adjust my microscope and look at the slides.
This is Mixie. Mixie is a 4-year-old female spayed mixed breed dog. Unfortunately, Mixie has suffered from severe pruritus with multiple areas of her body affected. Mixie's areas of pruritus include her paws, her face, and her underside. These are all common areas that are affected by allergies to things in the environment. This also can present as a food allergy with these areas affected. And Mixie did go through a diet elimination trial to discover if she was allergic to something in her old dog food or not. She failed to respond on the food trial, unfortunately, and also has been through several different medications that are intended to help pruritus. 2 of those were Apoquel and Cytopoint that did not help as much as the owner and wanted it to, so she was placed on Atopica, which is also cyclosporin, to see if this would help her. This has proved to be the best treatment for her, however, not enough to control her signs to the owner's satisfaction. And so because of the continued discomfort, she was referred for allergy testing to discover what in her environment is bothering her.
So whenever Dr. Gunner wants to conduct a skin test for a patient for potential allergens, what pharmacy does is that we draw up a skin test. What this is a diluted allergen for each type. It could be from a positive controlled histamine to a negative controlled saline. And what that does is it allows you to test how positive you are and how allergic that animal is for each type of allergen. It could be grasses like Timothy or Johnson grass. It could be trees, certain types of trees like ash or elm, to molds, different types of molds, as well as human dander, so even our animals can be allergic to humans, just like humans are allergic to animals, as well as ants and other insects. So what Dr. Gunner does in pharmacy, we will submit a request for that allergen skin test. Pharmacy will draw up all of those allergens, and then whenever Dr. Gunner is ready to conduct that skin test and the results are done, they're being sent to pharmacy to hold. When that patient and the owner is ready to start their allergy therapy, what pharmacy will do is that we'll do a starting series where Dr. Gunner and I work together and coordinate the allergen therapy. So pharmacy will receive basically a hyposensitization formula from Dr. Gunner, which has all the different allergens listed out and the amount and volume of the allergens we need to draw up for that patient, depending on how allergic they are, with the one being the most allergic and the most reactive, all the way down to 0.8, or sometimes it's half a mil of these allergens, depending on if we think the animal has a little bit of an allergy but is not as intensive as others. And once we have all of that information down, we'll draw it up, and then we'll start either a new set of allergen therapy, where the owner will start with the most diluted allergen to build up that tolerance, and then we'll go into a maintenance vial after each one. And then the injection's given at least once a week up until if they need a new one.
So from this test, what we plan to do is figure out what she's allergic to and then place those allergens into a form of allergen-specific immunotherapy, which means allergy therapy. So people go through this type of treatment as well, but with that, we would either teach these owners how to give her injectable allergy therapy, which includes the allergens that she's allergic to, giving them in small doses over time to build up tolerance. The other option is to do an oral allergy drop to help with this type of therapy. My favorite part of being a veterinary dermatologist is that I first get to care for animals and help them with their dermatologic issues, and also get to give the owner help by helping their animal. So those things are things I enjoy. I enjoy the specialty because it puts together many of the subjects in science that I enjoy, such as immunology, microbiology, because we deal with numerous skin infections in dogs that do have allergies. I love getting to know my patients and also my owners, which there are some specialty fields that you don't get to have that long-lasting relationship like you do in general practice. I enjoy that aspect, but I also get to specialize in a field that I love as well.